Hello and welcome. In this video we're going to look at the anatomy of the hip and pelvis. So first of all, as always, we're going to start with our bones. So we have the femur, which we've already discussed while talking about the knee. You then have the actual pelvis. So the pelvis is broken down into three sections. You have the ilium, which are these wing type sections. You have your ischium, which is this section here. And then at the front you have your pubis. You also have, if we spin them around, your sacrum here and your coccyx. So that's all the bones associated with the hip and the pelvis. Okay, so now we've gone through the bones, that wasn't too bad. Let's have a look at the bony landmarks. So first of all, we'll separate the two. We'll do the femur first. So here's the femur, obviously, nice long bone. You have the head of the femur here, which creates the ball of the ball and socket joint of the hip here. You have the neck of the femur, which is here. This is often broken when we fall. You then have the greater trochanter here, which has quite a few muscle attachments and is very superficial, so you can actually palpate that quite easily. You then on the back here have the lesser trochanter, which sticks out the back. You have a line that runs down the back of the femur, which is called linea aspera. So if you remember, your quadriceps will come off of this. So you have your lateral and your medial sides, and the quadriceps come around that way and that way. You also then have up here your gluteal tuberosity. So that's the bony landmarks you need to know for the femur. Let's now look at the bony landmarks of the pelvis. So first of all, iliac crest, a nice easy one. So that's this line here. Get Bob's arm out of the way and show you on this side. So it's this here. So if you pop your hands on your hips, you've got your iliac crest. You then have your ASIS, or anterior superior iliac spine, which is this bony prominence here. Again, it's quite an easy one for you to palpate. It's quite tender when you hit it because there's a few attachments around there, so that always tends to make it quite tender, and it's quite easy to find. And by finding that, you'll be able to locate the AIIS, which is the anterior inferior iliac spine. So this is a good one to be able to find because, like I said, there's lots of attachments, muscle attachments around it. You then have your iliac fossa, which is this surface here, and the ilium muscle, which becomes part of the iliopsoas, sits here. So that's there. Get your arm out of the way, Bob. Then opposing that, and on the back surface here, this is called the gluteal surface. This again is a nice easy one to remember because it's where your glutes are. While I've got Bob this way round, we have also got the greater sciatic notch, which is this space here, and the PSIS, posterior superior iliac spine. So it's part of that crest again, and it's just the posterior point of it. If we just bring Bob to the side then, so here we have the acetabulum. So this creates the socket part of the ball and socket of the hip. This is quite a shallow joint, but we'll talk about that in a minute. And then at the bottom here you have the acetabular notch. Similar to this, there's kind of a groove just in there underneath the socket. On to the front, looking at the pubis, starting with the pubic symphysis here, and then you have the pubic tubercles, which are here, and then you have the superior and inferior pubis of ramus. So superior, inferior pubis of ramus. And if I just swing him back around one more time, sorry Bob, here we have the ischial tuberosity. So this is the attachment site for the hamstrings, its origin. It's an easy one to palpate again. People get a lot of tenderness around here when there's issues with the hamstrings. So it's quite often called the sit bone because actually when we sit down, this is what we're sitting on. So the sacrum and the coccyx we'll look at as part of the spine, so we'll run through bony landmarks on those at a later date. But that should be all the bony landmarks you need to know for the pelvis. Let's now look at the joints of the hip and pelvis, starting with pubis symphysis here. So this is a cartilaginous joint, nice big piece of cartilage here, and this opens up during childbirth. So it's supported by a lot of ligaments, but when women become pregnant they produce something called relaxin, which helps to soften those ligaments, and then when you go into childbirth this opens up here. So this is pubis symphysis. There are some disorders that you can get with this, normally during pregnancy, but also I've heard about it in runners, so one to know about. Next we have the sacroiliac joint. Now this one's always a fun joint. I do get a lot of people with discomfort around this joint. So it's actually two joints, you have a left and right. The posterior surface of it is considered a fibrous joint because it is bound by so many ligaments, but the front of it is classed as a synovial joint, or the anterior surface is classed as a synovial joint, and it has two synovial capsules, one for the left and one for the right, which attaches the sacrum to the ilium. So that's your sacroiliac joint. The last one here is the hip joint. So this is a synovial ball and socket joint. The ball is created by the head of the femur and the socket by the acetabulum. So the acetabulum is made up of all three bones of the pelvis, so the ilium, the ischium and the pubis all connect in here. Now because this is a synovial joint, a ball and socket synovial joint, sorry, it has a wide range of movement which does leave it unstable. But it has lots of structures here to help support it. So first of all you have the joint capsule, so that comes from below the head of the femur up and encapsulates the acetabulum. You also have a C-shaped ring of fibrocartilage in here called the labrum, and that helps to deepen the acetabulum, so creating a bigger socket for the ball to fit into. It's also bound by lots of strong ligaments and muscles. So that's your hip joint, your synovial ball and socket joint. Let's now look at some of the ligaments of the hip. So we're going to look at two that are intracapsular and three that are extracapsular. So two that are inside and three that are outside. So the two that are inside, you have the transverse ligament, which is down here, and it goes across that acetabular notch that we mentioned earlier. You then have ligamentum teres, which comes from the head of the femur and attaches onto that transverse ligament and also the acetabular notch. So that's helping to stabilise the head within the acetabulum. The next three are outside the capsule. And they are the pubofemoral, which comes across here, the iliofemoral, which comes across here, and the ischiofemoral, which comes across here, or femoral. So they create quite a wrapping around the outside to help stabilise the hip joint and help to limit movement. So the pubofemoral femoral coming across here will help to limit abduction and external rotation. You then have the iliofemoral ligament, which comes this way, and that will help to limit external rotation again, but also adduction. And then the third one on the back, the ischiofemoral, will help to limit internal rotation of the hip, so that way, and abduction again. So if you noted, two of them reduce or limit abduction and only one of them limits adduction. There's much more range in abduction, so you need many more structures to help control it compared to adduction. So that's the ligaments associated with the hip. I'd now like to have a quick look at the ligaments of the pelvis. As you can imagine, there are a lot of ligaments associated with the pelvis, and we're just going to have a quick look at 3. So the first one is the sacrotuberous, which comes from the sacrum onto the ischial tuberosity, so it kind of tells you where it goes. You then have the sacrospinous, which comes from the sacrum onto the ischium, so more here. And the final one is the iliolumbar ligament. So it comes from the transverse processes of the 5th lumbar vertebrae onto the iliac crest, so it comes across this way. So that's the ligaments that you need to know associated with the hip and pelvis. Before we move on to the muscles, I would like to have a look at a few bursas very quickly. So as you can imagine, there's lots of bursa around the hip and the pelvis area, and we're just going to look at 4. So the first one is the iliopectineal bursa, which sits about here, so protecting the structures that come over here. It's in front of all those ligaments we looked at earlier. You then have a couple for the greater trochanter, so you have the superficial trochanteric bursa, which obviously is superficial between the skin and all the structures here, and the deep trochanteric bursa, which is obviously in behind, so it's between the trochanter and the structures to prevent rubbing on the greater trochanter. So that's the 2 there. The last one is the ischial bursa, which sits here at the ischial tuberosity, just to prevent anything rubbing on that bony prominence. So that's the bursas that you need to know associated with the hip and pelvis. I'd just like to finish up now by going through the muscles associated with the hip and pelvis. So we're not going to do origins, insertions and actions, we are just going to remind ourselves roughly where these muscles are. You have the additional videos from your level 3, which I've put into your level 4, so you can have a look at that. You've also got the full list in the manual, so you can check through those as well. I'm going to do my best to remember them all, so here goes. So we have psoas major, which comes down here, and iliacus, which sits here. So the 2 of those make iliopsoas, so that comes down through here. We have the TFL muscle, which starts around here and comes down onto and becomes part of the ITB, iliotibial band. Another important one is the QL, quadratus laborum, which sits here, so it comes off the bottom ribs and onto the iliac crest here. What else have we got? While we're this way, we've got the glutes. We've got glute max, which is the big one that we sit on. Glute medius is more over here, and then glute minimus is the deeper one there. What else have we got? We've got off the front, so not all of the quads, because not all of the quads cross the hip, remember. So we have, let's get Bob's arm out of the way. We have rectus femoris, which covers the hip and the knee, so rectus femoris. We've also got sartorius, starting from up here and sneaking down to the medial side of the knee. So we've got those 2 in the front. We've got all of our hamstrings, so biceps femoris, semitendinosus, semimembranosus, all of these here. And then we have the adductors, so all of the adductors will affect the hip. So you've got adductors, adductor magnus, longus and brevis. You've got gracilis and pectineus, so they're all the adductors. And finally, there's a group of muscles called the deep 6, and the only one we ever really think about is piriformis, because it's probably the most accessible of all of them. But they are very deep muscles in around the pelvis area. So we have piriformis, which is kind of coming across here. And then we have quadratus femoris, obturator internus and externus, and gemellus inferior and superior. So those 6 make up what we call the deep 6. And I don't really want you to worry about those. I want you to think about piriformis, but not so much the rest. But obviously all the other muscles we've discussed are quite important. So hopefully you found that useful. You can now go on and complete the quiz associated with this video and then move on to your next video, which I believe is the spine.